Laguna, and Rizal will be on modified enhanced community quarantine or MECQ again. Business will be allowed only for the essentials such as food, but mass transportation will not be available for workers. Government will implement a stricter lockdown in response to the clamor of health professionals. But will the MECQ for 2 weeks break the increasing trend of COVID-19 cases? We discuss in this episode of the Chiefs. Welcome to the Monday edition of the Chiefs. With us right now are Luchi Cruz Valdez, the head of News 5, and I suppose, hi Luchi. I suppose Ana Marie Pamintuan is somewhere there. No, she's still putting the paper to bed, the Philippine Star to bed.
Daming balita ngayon eh.
There you go.
Daming balita ngayon. We're like 4 hours or
before the MECQ. Yeah. And
parang
a lot of people have forgotten what that means. Kasi may pa siya huling
ang dami na namang tanong tungkol sa protocol guidelines, di ba?
Yeah.
Kasi nakalimutan na rin natin eh. And I think we were not ready for a reversal so soon after GCQ was retained, di ba? So
especially the supermarkets. Kasi ang supermarkets, puno, ang traffic ngayon kasi ang dami nagpupunta sa supermarket.
Public transport. Ay, nako.
Oh, there's Ami Pamintuan from the Philippine Star. And joining us later will be ROBY ALAMPAY of One News from the TV5 newsroom in Reliance Street. Ami, we were just talking about yung in a few hours, well, it's 8:30, so in 3.5 hours, balik tayo ng MECQ.
Kaya traffic kanina sa mga supermarket.
Yun.
Ay, grabe. Talaga. Lahat nagpanik. ATM. Talaga nangahaba ng pila. Tapos, ang dami nating nakalimutan eh. Naglabasan ulit yung mga quarantine pass. Diba?
Naghahalungkat ng quarantine pass.
Biglang, nabuhay na naman. Diba? Ang daming talagang we were thrown into a loop.
You can expect na midnight tonight, puro checkpoint na naman yan. At bukas ulit, puro checkpoint ulit yan. Especially dun sa mga boundaries. ROBY ALAMPAY is online from the TV5 newsroom in Mandaluyong. Especially sa mga boundaries kasi ang mahigpit talaga ang checkpoints yung nasa boundaries going in and out of Metro Manila and sometimes in and out of certain cities and the one town here in Metro Manila. So you can expect that again. At sabi nga ng NCRPO, maghuhulihan sila uli.
Yeah. At saka yung cross-city travel, di ba? Yun nga, parang yung mga nagpaplanong umuwi na from, say, other parts of Luzon, di ba? Kunyari, Baguio to NCR, biglang hold na naman. Grabe, nakakabigla. Hindi nakakabigla kasi,
that could probably explain yung ibang klase na naman yung traffic yan. It's Monday, we were expecting the traffic, but we do suspect that there were people rushing to get out of Metro Manila.
That too,
today and this evening. Kasi again, usually counterflow ako papunta from Quezon City, punta Mandaluyong na paggabi na. But traffic was really unusually heavy coming here.
Yeah.
Oh.
Kasi without public transport, ang daming nag-a-adjust ngayon kasi by tomorrow wala nang public transport. Kaya siguro ang traffic ngayon, marami nag-uuwian.
Saka kawawa yung mga nakamotorsiklo na bumili na nung riding, divider, tawag yun.
And even for those who are not trying to go home, and even for those who are not trying to get out, and even for those, in fact, who are planning to stay at work. Kanina binalita ko dito sa Big Story, groceries, so may maraming namimili, but among the complications are now they have to find bed space for the grocery clerks.
Right.
Hindi nila papauwiin to make sure that there's enough manpower to man our groceries.
Naku, Roby, huwag ka na lumayo sa news mismo. Diyan sa News 5. Balik na naman sila sa lock-in. Eto na naman kami. Tinitingnan namin kung sinong pwedeng mag-uwian, sinong pwedeng mag-lock-in. Grabe, and you had to do it all in one day. Kasi bukas diba?
Tsaka nagpapanik yung mga tao sa newsroom ngayon kasi baka magsara yung 7-Eleven.
Hindi nagsasara sa 7-Eleven.
Hindi, nagsara siya ng ECQ.
Nagsasara.
Sabi sila 7-Eleven sa amin, hindi, bukas.
Hindi, pag merong
they cut down on
positive.
outlets.
Oh.
And also they reduce the number of outlets open.
Yung isa pang pinag-uusapan na, yung nag-sermon pa si Presidente kagabi, di ba?
Yes.
Yan.
Cold pa sa mga yung mga nagre-reklamong yung mga humihingi ng tulong na health workers.
Yeah.
Yes.
Galing talaga ni Ami mag-segue.
Ampo.
Siguro,
Yan na, segue mo.
Galing talaga ni Ami mag-segue. Maaasahan ka talaga, Ami. Okay, well, let's introduce our first guest for tonight. Joining us tonight is Maricar Limpin, Dr. Maricar Limpin, the Vice President of the Philippine College of Physicians. Dr. Limpin, thank you po for joining us tonight.
Hi, Doktora. Welcome.
Good evening.
Good evening po.
Doc, I'm afraid we can't hear you.
Nakamute po yata kayo.
Doc, baka nakamute ho kayo.
Doc, nakamute. Nakamute kayo.
Oh, I'm afraid she. Well, we have two guests for tonight. One, of course, is Dr. Limpin, who will come back to us in a few minutes. And the other one is the Undersecretary of the DILG, who will talk to us, of course, about the particulars of the MECQ kasi mahalaga po yan tonight at bukas ng umaga. Medyo konting reminders. And I think some adjustments. I think they're having some adjustments as well with the MECQ. Right. They were supposed to have a meeting tonight between the IATF and the Metro Manila mayors for the details kasi they might have modifications. So modified ECQ.
Community quarantine, yes.
Yeah.
Kasi for example, among other things, the tricycles I think will be delegated or devolved. The authority for tricycles will be devolved to the LGUs. Hindi siya completely banned. Is Dr. back already? Hindi pa ata siya nakakabalik. So that among other things. And as well, actually, I suppose maraming interesado sa mga nagmamaneho kung total wala ng bus bukas, pwede bang gamitin yung bus lanes ng mga private motorists?
Oo nga pala, no?
Pwede.
Yeah. Siguro naman.
But I think, but I think, but I guess we're all speculating here. But I think, yung bus lane na yan, kahit pa paano, natuto na yung mga tao to respect it with or without a bus. And I think it's something that for the sake of argument, it's best to just leave it as it is and for people to continue to respect that lane whether or not may bus. Mas mahirap pa yung babalik yung mga private cars doon tapos pagka bumalik yung mga bus, panibagong behavior na naman, teaching people to respect that.
That's true. And I suppose we'll have a smaller volume of private vehicles tomorrow on the road, so mas konti siguro yung traffic. That's assuming that people follow the rules. Kasi dapat tomorrow, essential workers lamang yung lalabas at yung may mga konti pass.
Binalik na rule, ang isang binago na rule na kailangan maintindihan ng tao, backriding, wala na naman. Kahit mag-asawa at kahit mag-live-in, bawal po ang angkat.
Actually, ang daming nabitin na nag-open lang nung Saturday. Di ba? Yung mga gym, yung mga tutorial services, yung mga internet cafes, lahat, no? So, kakabukas lang nila biglang, sarado ulit. Nagbitin.
Buti nakapagpagupit pa ako.
Habol ka. Gym ang hindi mo nahabol.
Ay, wala akong balak doon.
Mahabang pila sa mga barberia kanina. Daming barbershops na...
Ganon ba? Nako, paano tayo, Ami? More kulay by do it yourself.
Ako naman nagupit nito. Ako nagupit ng buhok ko. Nag-DIY.
Yeah. You know what's interesting? Sabi ng Okta, nababawasan daw ng 50 to 70 ang cases within 2 weeks.
From the worst case scenario. Because the worst case scenario,
200, diba?
220,000. So they're now saying maybe 150, maybe 170.
Yeah, no, but still, that's
Nandiyan na yata
considerable.
si, ano,
Ah.
Yeah,
That's
I think
significant.
Dr. Limpin
Okay.
is back online. Dr. Maricar Limpin, Vice President of the Philippine College of Physicians. Doc, good evening po.
Good evening.
Hi, Doc. Can you hear us?
Wala pa rin audio, no?
Wala pa rin siyang audio.
Well,
Wala pa rin yung
can you hear
audio.
us?
Wala pa rin siyang audio.
Baka naka-Bluetooth?
Med- medyo
Check niyo po, baka yung Bluetooth nakabukas.
Medyo
Minsan kasi pag naka-Bluetooth.
nakinig ba kayo kay Presidente kagabi? Medyo
Oo.
nakakalimutan yung ano niya eh.
Revolution.
Oo, yung sa revolution eh. Kaya,
Tampo tampo. Di ba? Mararamdaman mo yung tampo niya na
Because I think
demean the
over-
government. Ganyan yung mga words niya eh. Don't demean the government.
No, because I
parang-
think emotions were frayed over the weekend kasi unang-una yung paggising mo pa lang with the statement of the medical association, ramdam mo talaga yung exasperation and yung fatigue and yung tiredness, the desperation, the sense of urgency from all the medical associations. I caught the webinar, and by the time we had logged on, it was like 16,000 viewers, simultaneous viewers of that joint gathering, of that summit of association. And then on the side of government, ramdam mo yung, I don't know how to phrase it fairly, but really, hindi tampo, but no answers. At the same time, it was somewhat defensive, and hindi mo rin alam kung lugar yung statement. I was holding my breath. I was really hoping that the president wouldn't go all the way to what we all feared he might say against the
martial law.
Diba? Or really going all out and attacking parang he wanted to say, lahat tayo nahihirapan. That was my sense of it. But at the same time, he had to reassure the medical association that I hear you. That's how he started off. And then it became about government.
Actually, very defensive for Secretary Duque. Diba? He became very defensive. And although hindi naman pinoint out si Duque sa letter, parang mararamdaman mo nga na ang pahapyaw ng mga health workers in general, di ba? It's really walang leadership from Secretary Duque. So,
well, anyway, he's staying again. Sinabi na yung huli ni Presidente staying. Andiyan na ba uli si Dr. Limpin?
Wala. I think they're trying to have her restart her phone.
Wala pa rin.
So anyway, that's one among many things that we can talk about with Dr. Limpin later. Yung sinabi ng Pangulo, and of course, itong ginagawa ngayon ng gobyerno na MECQ. I think they originally wanted it to be ECQ, but I suppose this is a compromise of sorts. But let's see what the doctors, what the medical side has to say about an MECQ. Will it be enough from their point of view, or will it not?
Tsaka it's not enough time out. Yun ang hinihingi nila di ba?
Yeah, time out.
Time out.
Actually, 2 weeks na lang hinihingi nila
Sapat na ba yun? Oo. Sapat na ba
Time out
yun?
din muna tayo habang hinihintay natin.
Yeah. Ang galing mo talaga mag-segue, Abby.
Ang galing mo. No, game na.
Okay. We'll just pause for a break, so please stay with us. Welcome back to Chiefs, and finally joining us is Dr. Maricar Limpin, the Vice President of the Philippine College of Physicians. Dr. Limpin, thank you for joining us tonight.
Yeah, and good evening, everyone, and thank you also for this invitation.
Good evening.
Good evening din
Good evening
po.
po.
Good evening po.
Doc, of course, we want to talk about the President's response last night. That's top of head for a lot of people. Pero I suppose what's more important to talk about first would be, the College of Physicians wanted a stricter quarantine, at least for the next 2 weeks, to give some breathing room for the whole response network. Now we are under, at least in a few hours, we'll be under MECQ. Is that enough from your point of view? Would that be enough breathing room for the next 2 weeks?
We believe that it is quite enough because at least we really wanted a stricter community quarantine that will be implemented in the whole of the National Capital Region. So MECQ will be better than the general community quarantine that we have in place. No? So that's good enough. At least it's good enough for us to help, no, stop the spread of infection, and then most importantly, it is also good enough for the government to really step back and recalibrate, no, yung mga strategies that will help us really win the war against COVID-19.
By
Mhm.
recalibration,
In the meantime, Paul, give us an idea of what our frontliners and their institutions, so the hospitals, the doctors, the nurses, in the next 2 weeks, what can you do? What will you actually be doing over the next 2 weeks to make the most of this timeout?
Robbie, I don't think that we will be seeing really a dramatic decrease in the number of COVID-19 infections, no. But for our group, no, for the whole for the 100 medical organizations that are in place, no, who are supporting this call, I think we will be able to help the government, come up with more effective programs that will really be able to control the spread of this infection. Right now, as we are speaking, my colleagues are already in the meeting with the National Task Force, no, on COVID-19, and therefore this is actually an opportunity for us to point out some of the recommendations, no, that we have in order to improve the control of the infection.
Nawala ulit.
Mm-mm.
Ma'am, doctor, nawala ulit siya.
Now,
Ayan, yeah.
Okay, we'll try to bring her back in a few. Oh,
Yes.
Well,
she's kinda
yeah,
back
she's
online.
back. Yeah.
Ayan na.
Yeah, sorry, ma'am, we lost you for a bit.
I can't hear you.
Pakiulit, ma'am.
Can you hear me, ma'am? And can you hear any of us?
Can you hear any of us? Dr. Limpin, can you hear any of us?
Wala, mukhang may problema sa
I
connection
guess at least
talaga.
no.
But I get the impression, I mean, kasi remember yung sa panawag na to, there's a call na mag-recalibrate ang gobyerno. At the same time, they were saying they needed time. Not that they needed time, but they were expressing yung pagod at saka, but I get the
Exhaustion is the word, yeah.
Yeah, I get the impression
no?
that nothing changes as far as that's concerned. Parang tuloy pa rin, wala pa ring pahinga, in other words.
Yeah, yun ang sabi niya. Kaya nga sabi ko, so para saan yung 2 weeks, no?
It's really for government.
Tuloy pa rin pala. So they're doing this for government. So I guess the next logical question is, what are you sitting down with government for? What exactly are you demanding of them, no? Parang how, where did government fail, at least from their point of view? Yun. So
I suppose from their point of view naman talaga, they were not going to be given any rest. It's just give the whole process of time to reboot so that you have less cases. Doctora, thank you for coming back. Can you hear us?
Doctor, hindi niya tayo marinig.
Sayang, bitin na ako, ha?
Oo nga.
Okay.
Yan ang problema kapag nag-blended learning, paano kapag ganyan yung mga klase?
Yeah.
Oh,
No.
pag tinawag ka ng teacher mo for recitation, ma'am, I cannot hear you.
Pag hindi niya alam yung answer. I'm sorry, ma'am, hindi ko kayo
Ma'am,
marinig.
choppy.
Considering 20 yung estudyante,
O
no?
talaga,
Anong
bibigyan mo ng
20?
idea ng mga bata.
40 to 45 yung 40 to 45 ang average.
Yan ang idea.
Parang si Ami, is it just on my screen or si Ami lang ang nagpapanggap na malinaw ang signal?
Ah.
Hindi,
Wala
Roby, ikaw malinaw ka pero yung audio mo choppy. Lagi.
Yung choppy.
Lahat tayo problemado. I will log out, I will come back.
Pero utos na sila sa LGUs today.
Ayun, nawala tuloy si Rob.
3 days.
Natuluyan.
Kailangan ko yung application for telcos. That's one of the stories today. The LGUs,
sorry?
3 days. They were given 3 days.
For LGUs to approve permits
Yes.
Application
for cell towers.
One of the stories
Yes.
today. 3 days.
Oh,
3 working, kahit hindi
Para daw-
working niya,
yeah.
kahit hindi
Oo.
calendar days, mabilis pa rin yun. Sana nga matulog.
Para hindi na raw sila masisi. Kasi lagi raw, sinisisi raw
Wait,
ng gobyerno.
is that a hard number? 3 days? That's a hard number talaga. Kasi, di ba, sabi nila, it takes 29 permits to be signed.
Kaya nga, so we're thinking 3 per permit. 3 per permit.
3 days per permit.
Hindi ko alam.
Pero yung anti-red tape, pinababa na
Talaga.
sa 17 days. From the, what used to be, months, no? So,
Within
I don't think yeah. Hindi
within
naman siguro 3 days per permit. So, 29 times 3. Parang
Kasi magiging 3 months yan.
3 months.
Kung 29 permits. Si Dr. is back.
Yeah. Okay.
Hi,
Doc, can you hear us?
Doctor.
Yeah, I can hear
Yeah,
you.
there you go.
Ayan, okay,
There you go.
at last.
Okay.
Yeah, you were,
Doc,
yeah.
tinatanong lang namin because you're asking for a recalibration of the response. Ano po ba
Yes.
yung mga suggestions niya to recalibrate? What are you hoping to see within these 2 weeks? Mga viable that the government can do?
First, yung ma-put into place talaga yung more specific and more detailed way of doing the contact tracing. So, very important yan, contact tracing. Because if you are not able to follow up the people who were exposed to a COVID-19 patients, then you will not be able to identify them and isolate them, or put them on quarantine. So, pag hindi natin ito nagawa, then we will have failures because this will also cause continuing spread of the infection. And then the second one is really be able to have the more effective way of identifying patients who have COVID-19, no? So case finding ang isang malaking problema rin. And one reason why we are not able to do this more correctly is because of the persistence of some of our local government units in the test that they make use of in determining whether a patient has COVID-19 or not. So most of the time, napansin naman natin, there is too much reliance on the rapid antibody test.
Mhm.
Yes,
Oh.
and oftentimes in the past we have already told them that it is not reliable, no? At the most, ang sensitivity niya is only about 50%. So, people should understand, pag sinabi namin 50%, it is like, tossing a coin, no? 50-50
Yeah.
Yes, ma'am.
Actually,
malalaman mo.
That's yes or no lang eh. So parang hula lang. Pag ganun, parang hula lang talaga. Kasi yes or no
Yes,
na naman, that's
right.
already 50%.
Yes,
Yeah.
right. So, pag sinabing 50%, ang ibig sabihin niyan is a useless test, no?
Right.
So, we're actually putting resources to something that is not, that will not
Reliable.
be helpful,
Yeah.
no? So, still ang diagnosis natin will be dependent on the PCR, no, yung swab test. But there is a very promising test that we can actually look into, and we discussed this already with the Department of Health earlier this afternoon. And yan yung rapid antigen test, no, which is
Antigen.
well, yes, the antigen, hindi antibody,
Yes.
no. This promises to be a more reliable test over the rapid antibody test. But of course, it still needs a little bit. We still need to really see kung yung magiging results ng mga nakikita namin. Pero so far mukhang mas maganda siya, no, compared to the rapid antibody test. And that is actually what we have also discussed already with the Department of Health. As far as testing is concerned, we are one naman with the Department of Health, no. Nagkakaintindihan kami nila Secretary Duque and the people of the DOH. So yun nga lang pagdating sa implementation, kasi yun ang nagiging problema natin, because dependent actually doon sa LGUs yung implementation ng mga test na ito.
Doc, medyo na-confuse ang public dun sa question on effective nga ba talaga ang mga lockdown. We were already slowly moving toward the thought that lockdowns can only do so much. So we were kind of like thrown into a loop when your group asked for an ECQ. Over the long term, do you really think that quarantines help if the public solutions you're asking for are put in place?
We believe kasi yung nakita namin, no, observing from what has transpired the past few months when we move from ECQ to MECQ and then now to GCQ. What we noticed was the change in the behavior of people. So I think the putting the NCR in a stricter or tighter community quarantine will give the message that the public must really follow the necessary measures in order to protect ourselves and also to prevent the spread of infection. In the other countries, no, they have when they were able to apply the community quarantine, the lockdowns, no, these are the countries that have shown to be able to successfully control the pandemic,
Spread.
no, at the spread of the infection at an earlier time. So yan, nakita natin yan sa Vietnam, and we see Vietnam how they are doing right now, no, and that is exactly because they have immediately placed their country on lockdown. Tayo, and medyo kailangan talaga medyo patatagalin mo until such a time na na-control mo talaga ng maganda yung infection.
Kasi Doc, yun nga yung kinatatakutan. After August 18, pag nag-GCQ, balik na naman sa dating gawi. So parang paulit-ulit lang. How do we make sure that that's not gonna happen?
Yeah, so that's why we're talking with the Department of Health that included din dito is to make the public understand, no, that we need to continue the behavior of putting our mask on and also maintaining the physical distancing. Kasi di ba napansin niyo, no, through the weeks that have gone by, marami na mga tao na who are not really following, or if and when they are using their face mask, they're using it
Mali.
wrongly.
In the wrong way,
So, the wrong way, no? So instead of making sure that both the nose and the mouth are covered, no? So it has to be na covered parehas, no? Ay yung iba sa kanila you will see na it is showing their nose, or probably they're covering the chin. Hindi naman yun ang tamang pamamaraan. So basically, you are still promoting the spread of the infection.
Doktora, loud and clear po yung message sa public, and in fact consistent from the very start. the same
Yes.
time, we said kanina, if we appreciate it kanina correctly, that this timeout is really about government having the time to recalibrate and reconsider the, In the meantime, there's still the matter of the exhaustion of our frontliners. Ano po yung options ngayon ng frontliners, ng doctors, ng hospital to give some relief, given that we've been hearing reports of people resigning, nurses not wanting to sign up? What options are available to our frontliners and to our medical institutions to provide some relief and to improve the working conditions for you, at least for the next 2 weeks?
The most important really, Robbie, is to prevent the spread of infection, because it is only through that we will be able to relieve also the bulk of work that we are seeing right now. No? But in the meantime, as you said, no, it is probably best to be able to mobilize the existing and the current health workforce that we have. Department of Health definitely has the doctors and the nurses that are available within their department. So these people can actually be mobilized and sent here probably in the National Capital Region. Of course, that is provided that their area where they are staying right now is not burdened also with so many COVID-19 patients. Pero again, if we look at the totality of the country, it is really the main burden of COVID-19 is seen and experienced here in the National Capital Region.
Yes.
Some nearby provinces like Laguna, Bulacan, and also Cebu, some in Iloilo. So hindi naman lahat ng buong bansa ay experiencing this problem. So the Department of Health can probably mobilize some of its people
Yes.
to go to some areas, to
Right.
beef up the health workforce.
Yes, they're talking about bringing in substitute health workers, no, and they're also looking to hire an additional 10 to 20,000. Do you think that's sufficient? Also giving cash aid, risk allowances, are these helpful?
Maybe, yeah. But for our group, no, we're not really looking too much into the incentives. No, I think that recommendation is coming from another group, but it will help, no, especially in hiring the needed additional workforce here in Metro Manila. So the incentives that the government has, the Department of Health has in mind, will help in being able to achieve the objective of adding up to the health workforce in NCR.
Ma'am, I mean, how did we get to this point? How would you assess the communication protocols and communication mechanisms between the medical associations and government and IATF in particular?
We have had some of our colleagues, who are also part of the advisory committee of the Department of Health. But I believe that it is very important that probably the ears of the medical community will or the ears of the leaders of the country, in particular the president and the other members of the IATF, will actually hear the voice of the medical community, because sometimes hindi rin nabibigyan ng yun lang namin, maaaring hindi na bibigyan ng
Hindi, pero yun nga po, ma'am, if you don't mind, I guess that's my question. Put beyond tingin, ano po ba yung sistema? How often are you consulted? Is there a regular meeting prior to the developments this week? And paano po ba yung sistema for coordinating with the medical community prior to this weekend?
Not so regular, I would say, no. Then that is the reason why we ourselves no do not know exactly kung saan nanggagaling yung mga ibang ginagawa, lalo na sa LGU, no. So we're really talking about the LGUs, no. So probably that is one aspect where improvements are needed, no. The communication probably from the top level of the interagency of the IATF and the DOH to the LGUs. Baka kasi hindi din masyadong very clear, no, kung ano yung dapat na gawin sa mga LGUs. But of course,
But Doctor, it's not just communication with the LGUs. Kasi as we saw last night, it appears that even the president misunderstands the message that you wanted to deliver over the weekend. From your perspective, was there any room for misunderstanding the message that you wanted to deliver over the weekend?
No. There should not have been any misunderstanding. But I think the misunderstanding came about because there is another group of
Yes,
yung number
doctors.
of doctors.
That's right. Ako, nawala na naman.
Oo.
Yes, but yes.
Parang grupo yun.
Ayan na.
Sila. Doctor.
Doctor,
Doc?
could you say it
Go
again?
ahead,
Could you
please.
repeat, Doctora?
Doc?
Doc, we lost you a while ago. Could you repeat what you said?
Pakiulit lang. Yes. Akala ko sama-sama sila, di ba? Mga 100, from 40 to 100 groups
Yeah.
daw. Yung ano na yung medical group.
Hindi, tapos merong maliit na group. It's just a group of, I think, 8 or 9 or some. Maliit lang eh.
Medyo mas
Oo.
militante
Yeah.
yung age. So,
Yes, yes.
nag-jumble na yung yung mga sagot.
Right.
At medyo
Right.
magagabi.
Oo nga eh.
She's coming back online.
Ayan,
Doctora,
there
can you
you
hear
go.
us?
Doctor. Yes. Doctor, you were talking about medyo masama. Doctor, can
Nawala
you
ulit ang audio.
Nawala na naman.
Okay, we lost our audio again.
Yes. Yung audio na lang, audio. Okay, nawala ulit.
Okay. Naku, sayang naman. Wala tayong closure. Wala tayong closure.
Yeah, but let's recap yung mga let's recap yung mga sinabi ni Dr. Limpin. Diba? Again, it really is about letting government buy a little more time, so hopefully they can recalibrate, as they said, yung strategy. But it doesn't buy time for the frontliners. Diba? Walang pahinga, dire-dire.
Yeah.
And now they're going to have to consider calling in health workers from other parts of the country that hopefully are in a better situation, that can afford to send their frontliners to the areas that need. But definitely, it's not about, kasi sinasabi timeout eh. It's not pahinga po yung mga doktor. Dire-diretso po yung pagod nila, dire-diretso yung hirap nila.
So,
Saka
hindi
yung recalibration will take more than 2 weeks, I would imagine. For example, even just that new antigen test, no? Meron na ba niyan? Is that available? Diba? Ganun yung mga tatanungin mo dyan eh.
Oh, but remember, Lucy, this also opens up a can of worms with regards to the rapid tests. We had been hearing that, and to hear it again is still shocking. 50%. Diba? No better than taking your chances with a cost coin. And so it will bring up questions of, wait, how much have we spent on these tests so far?
Yes.
Diba?
Effectively, it's a toss coin. It's a toss coin, and you only have two choices anyway. It's yes or no, positive or negative, which is exactly what that is when you say 50-50. So,
and
para
then,
lang talaga nag-flip ng coin.
Oh, and then babagsak ka na naman doon sa, then what are the real numbers? We're already talking about 100,000 plus, and then now we don't even know.
Okay, we'll try again.
Finally, let's ask.
Doc, yung last na lang, Doc.
Yes, Doc. Pakiulit na po yung sasabi niyo before we get cut.
Did the government misread your plea?
Yeah, mukha kasing naguluhan ang gobyerno natin, dahil there is another group who actually sent also a message to the president, composed of a few number of doctors and nurses. And sila itong marami silang mga complaints, and also sila itong merong mga hinihingi na, na marami silang mga hinihingi, no? And I think that also includes the incentives that you mentioned earlier on. And also yung auster of certain persons, no?
Yes, yes.
In particular, si Secretary
Secretary.
Duque. We really don't, we did not request for any of this. And if
I
you
see.
probably saw our letter, if you read our letter, we did not make any complaints at all. But we are actually trying to tell, giving out recommendations on how we can better improve the controls that we have right now, as far as the spread of infection is concerned.
Yes.
We are one with the government, we are one with the president in this fight, and we believe that we cannot be doing this all on our own. The government cannot do this all on their own. We have to be unified, no, in this fight against COVID-19.
Yeah, agree.
Okay.
Okay.
Well, Dr. Maricar Limpin, Vice President ng Philippine College of Physicians. Ma'am, maraming salamat po for joining us tonight.
Thank you, ma'am.
Thank you, Ren, for giving me the opportunity.
Thank you.
Okay, we will just pause for a break, so please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And now we'd like to welcome Undersecretary Epimaco Densing of the Department of the Interior and Local Government. Good evening po, Usec.
Yeah, good evening, Amy, Gucci,
Hi, sir.
Good evening,
Good
sir.
evening, sir.
Sir, bukas ang umpisa ng MECQ natin, and people are pretty familiar with this state of quarantine. Pero ang balita namin, meron daw kayang konting modifications that you were discussing today. What can people expect tomorrow? Exactly the same ba ng previous MECQ? Or meron nga siyang pagkakaiba bukas?
Well, yung pagdating ng MECQ tomorrow, actually 12 midnight today, it will be the same as when we implemented it a few months back. There will be the dining restaurants will continue to operate, but no more dining operations.
Yes.
We will only allow the takeout and delivery services. Businesses most of them will be closed except those allowed under specific businesses and at 50% capacity. There will still be construction, but it only will be those construction allowed under public construction as allowed by the DPWH. I think, if I'm not mistaken, there will be a reimposition of the curfew. I think that the current curfew is 10, 11, or 12 midnight, and from what I heard from the mayors, they're looking at 8 o'clock in the evening curfew, at least for the National Capital Region. Checkpoints will now will be back, and nobody can just go in and out of the MECQ area unless they are the authorized persons outside the residence of the APOR. And of course, they are workers of those businesses that are allowed to open at a limited capacity. So exactly the same.
Usec, kanina nga we were talking about the traffic. Among the things we were theorizing on, there must have been a rush of people leaving Metro Manila over today, yesterday and today, anticipating this new MECQ. What about LGUs outside of Metro Manila, beyond the MECQ, nationwide for that matter? Are protocols in place as well for people who may have rushed out of Metro Manila today?
Well, right now, I'm sure many of them are prepared. No? Again, there are 4 provinces outside of Metro Manila who are also under MECQ. That's Bulacan, Laguna, Rizal, and Cavite. So I'm sure they're not going to those areas. And it's expected, the same as what had happened prior to, I think that was in March 16, a day before the ECQ was imposed, everybody went out of Metro Manila. However, what had happened there was it was a misnomer because the whole of Luzon was put under ECQ. But more importantly, what we're expecting is there will be a slowdown in business, but it is at least this is different from the total under ECQ where there is really a total lockdown in where we'll not be seeing a lot of people down the streets.
Okay, now, Usec, on the
I'll
other
just
side
zoom
of
in a bit.
The other side of it, dun sa, sige. Go ahead.
Well, Usec, I'll just zoom in a bit kasi I think a lot of people would want clarity on this. Sinong huhulihin ng mga pulis pag nasa labas? Do you need to have a quarantine pass na bago?
Yes, yes.
Of course, maliban doon sa IATF IDs na binigyan yung ilan. Pero who's allowed outside and who's going to be arrested for being outside?
Ngayon po, i-reimpose ang pag-i-issue ng quarantine pass. I think there's already a directive which will be coming out at the latest tomorrow, where the local government units, the governor, the mayor, down to the barangays, may issue or will issue a quarantine pass. So the quarantine pass, again, the same concept. One household will be given one quarantine pass, which is transferable to any member of the household. So isa lang pwedeng lumabas para bumili ng essentials like food and household requirements. No? So expect that. The other one is hopefully our local government units can already issue a uniform ordinance specifically on those not wearing face mask or not properly using it, and those who are not practicing social distancing. I think they're meeting right now, and hopefully they can have a common ordinance, at least in the National Capital Region, where when it is issued or when it is signed by the mayor, ito na yung magiging basis para hulihin sila ng kapulisan natin. In the meantime, in the absence of the ordinance, yung lalabas na walang face mask, pauwiin lang sa bahay, or wala kang quarantine pass, pababalikin ka sa bahay. Para sa mga allowed na lumabas na mga manggagawa, like those in the BPO industries or those who are skeletal forces in allowed industries, an ID can do. An ID will also be recognized, including the rapid pass.
Usec, paano yan? Bukas na. So, you mean to say, lahat sila pupunta na naman sa LGU para kumuha ng pass? Di ba nila pwedeng gamitin yung dati nilang pass muna? Kasi 2 weeks lang naman to eh. Di pipila na naman sila, tapos gano'n na naman, wala na naman. Yeah.
Tama yan, Aluchi. Kung hawak pa nila pass, I think yung iba pagagamitin. Pero ngayon sinasabihan natin sila, mayroon naman tayong mga barangay tanod, magbahay-bahay nila yung barangay tanod para hindi na lumabas ng bahay. Sa tatanungin bawat bahay, quarantine pass, kung wala, i-issue na kagad ng isa. Good for one household.
Oo, yeah, okay. Kayo pala na COVID positive no
Survivor.
July. Yeah, survivor. Can you tell us a little more about what you went through? How bad was it?
Well, when I went to the emergency room after my X-ray was total failure. That was the exact words from my doctor. Bagsak yung aking X-ray. So I thought all the while I was in severe pneumonia, but 3 days, actually I only learned 3 days after I was discharged that I was in severe pneumonia state. No? In other words, at 50-50 talaga ako. I think what saved me was when I was admitted to the ICU, it-administer kagad sa akin steroids. And my body actually responded in 2 days time. In fact, nakabalik kagad ako eh. But yung aking oxygen level when I entered the hospital, the emergency room, was at 85. Bagsak din yun. Our normal oxygen level should be 96 and above.
90 something. Yes,
Kaya hingal ako. Hingal ako. And it took me 4 days before I decided to go to the emergency room because I thought it was an ordinary flu.
Nag-donate na ba kayo ng plasma, sir?
Yeah.
Nag-donate na ba kayo ng plasma? Oo,
I did. That's the first document I signed in the first day.
Anong drugs? Do you remember?
Everybody to know,
Do you remember kung anong drugs ang ginamit sa inyo for treatment? Do you remember kung mga drugs ginamit?
Yeah.
What had happened there, maraming drugs eh. Kasi primarily, pag may steroids kasi, it will have side effects. And I was told some stories that those who initially died of COVID-19 during March or April, sabi nila hindi daw sila in-administer ng steroids because daw side effects. Yung mga namatay. So ako, administer ng steroids, it did have side effects. That's why I had a number of doctors monitoring my heart, my blood sugar, my kidney, my liver, because nandun yung side effects. So they were trying to balance it. Well, I had the side effects, but I survived. So I think, to me, the steroids was key.
So being a survivor, okay sa inyo itong binalik tayo sa MECQ, considering the risks involved sa nakikita nyo?
Well, to tell you frankly, in the last IATF meeting, because I chair the screening and validation committee for those local governments who want to appeal their community quarantine status for the next period, no? Ang NCR talaga, MECQ was the original proposal of the data analytics team of the PLH. Kasi po, although maganda yung kanilang case doubling time, it's around 12 to 13 days. If you look at their critical care utilization rate, umabot na muna 80%. So in other words, nasa risk level na. And if I remember it right, based on what I personally experienced, the month before, which was the day I entered the hospital, madali ako nakapasok kasi maluwag. In other words, the COVID patients were already leveling up in terms of number, and the healthcare system was already able to address the number of COVID patients. However, in the past week or so, especially the last 4 days, the numbers of infection was alarming. 3,900.
5,000 nga yesterday.
5,000. Yeah.
So that was really very alarming. I do think while there was really no proposal for ECQ, I think the MECQ is the more acceptable community quarantine classification for Metro, which is the original proposal during the IATF meeting. What had happened there was there was a debate because again we're talking about our economy also failing.
Yeah.
So what had happened there is, yes, let's do it for GCQ for the NCR, but let's put more stringent measures. Let's put more lockdowns. More importantly, there was a directive to the hospitals because nandun yung critical care utilization rate 80%. To increase for the private hospitals to increase their COVID beds from 20% to 30%,
30.
and for the public hospitals from 30 to 50%. That's a mandate starting last Thursday.
Now, Usec, in the meantime, of course, ang concern din ng mga tao is dahil biglaan ulit bumaliktad na yung policy just 4 days ago, we were saying the LGUs won and businesses won in the argument for opening up the economy some more, and then a few days later, balik tayo sa MECQ. People are wondering what might be some unforeseen consequences. Yung scenes ng locally stranded individuals, for example, people who suddenly are trapped in Metro Manila and so on. Is there any concern about that problem with stranded individuals are playing up all over again, or perhaps or even accident, or have we learned our lesson and do we have protocols to make sure that the season we saw in Rizal Coliseum won't happen again?
Well, first of all, the ultimate objective of the president is to save lives. And he's trying to balance it by putting some economic activities. And this is the reason why nasa MECQ tayo starting tomorrow. Because there are still economic activities under an MECQ setup. So hindi tuluyang babagsak yung ating ekonomiya. So people will have to stay at home at least for the next 2 weeks. That's number one. Number two, kagandahan nito, as pronounced already by Secretary Anyo a while ago during the meeting with local officials, titigil din yung pagpapauwi ng LSIs. So for the next 2 weeks, walang LSI na uuwi, pababalikin, and based on the numbers, many of the provinces and local government units outside of Metro Manila, the reason why nagkakaroon na sila ng COVID cases, I think between 50 to 70 or even 80% of their COVID cases are really from LSIs. Kasi ang LSIs, pag dala nila doon, tiningnan lang ng city health officials. Wala talaga silang rapid test, not even or RT-PCR or swabbing. No? However, pagdating naman doon, may protocols naman tayo. Pagdating naman doon sa probinsya, automatic quarantine sila for 14 days. And they're okay with that as long as they're already near their homes. Pero many of them get positive after swabbing. So alam na ho natin. So we're sure, one thing's for sure, itigil yung pagpapauwi natin ng LSIs, hindi rin madadagdagan ng mga COVID cases sa probinsya, at least for the next 2 weeks. Hopefully, if we are able to contain the infections, at least kanina, naging 3,600 na lang yata, or 3,200. If we can go back to our numbers 2 weeks ago, which has an average of between 1,008 to 2,200 per day, I think we will be able to be in the right position again. Pag ma-maintain natin dyan, and that's actually nearing the flattening of the curve, baka pwede natin ibalik na uli sa GCQ. That's something we're looking forward to, and we will be very strict, especially in lockdowns. Identify kaming pondo sa Quezon City, 8 ang may tama, nadala kagad namin sa local government units, yung kanilang local epidemiology and surveillance unit, and kinontain na ho nila yung mga may sakit doon. So we have to be very fast. We have to start micromanaging. That's what I told the IATF in our latest meeting last Thursday. We have to start micromanaging, because if we don't, we will continue to experience this crisis by not containing the virus. We have to start.
Sir, nakakatakot yun. Baka mamaya, pagkatapos na naman ng MECQ at nag-GCQ, balik na naman sa, alam nyo na, complacent behavior.
Well,
how do you instill that holy fear? Kumbaga, kahit na GCQ, dapat takot pa rin na mahawa, di ba? Pero nawawala yun, sir, sa sobrang desperado ng mga tao to go to work, to take the public transport, etc., etc. How do you make that happen? That behavioral change.
It will be a messaging, no? Importante ating communication to how they will manage to convey that message to the people here in the National Capital Region. Alam nyo, sa Cebu, when they were put under ECQ, in 2 weeks' time, they were able to bring down their community quarantine classification immediately. Ngayon, naka-GCQ na sila after 2 weeks or 3 weeks. No? So it's important that we take this seriously. So yung mga kababayan natin na nakakarinig ngayon, and hopefully this will be the same strategic message that the Malacanang will tell the people is, at the end of the day, it really depends on us. Government can only do so much. At hindi natin malalaman. Ako, Luchi, when I was trying to trace where I could have gotten this COVID-19, hindi ako naglalapit sa tao eh. So it's possible, it's one of the surfaces that I was on or near with, which at some point, tinanggal ko saglit yung aking face mask para makahinga. So ang tingin ko, it's one of the surfaces na kung saan ako dumaan on my way home or on my way to home. I don't think I got this from somebody or some person. So hindi to tao, no? Sabihin, pag lumabas ka, punta ka sa isang area na nandun pala nagstay yung virus at least for a few hours or a few days, baka doon mo makuha yun. So paliwanag sa tao, please help us in the discipline of the people not going out to ensure themselves to be secured in their homes, not getting the virus is very important.
Alright.
Okay. Maraming salamat po, Undersecretary Epimaco Densing, sir. Congratulations for beating the virus. And
Nabuhay po kayo.
mabuhay po kayo.
Hindi ko pa alam kung gaano ko katagal maging super president. Nobody knows. Salamat po.
Thank you, sir. Ingat po. And that will be all for this special edition of the Chiefs. We hope what to discuss here will keep the conversation going. I'm Edwin Galpa News.
I'm Ami Pamintuan of the Philippine Star.
I'm Luchi Cruz Valdez of News 5.
I'm Roby Alampay, and we are One News.